Thank you very much for the introduction and for the opportunity to speak today on polycystic ovary syndrome. I'd like to start with a quick question for the audience. Who has heard of PCOS? Raise your hands. Okay, lots of people here today. So let's get started. So, get to the first slide there. Perfect. So what is PCOS? PCOS is a common health condition that affects how the body processes hormones and can impact both metabolism and reproductive health. It affects millions of women worldwide, with recent estimates suggesting that around 10 to 13% of people with ovaries are affected by this condition and experience PCOS. And women with PCOS are impacted over their lifetime. Although PCOS has been recognized for centuries, our understanding of it has changed over time. Historical records describe people with symptoms like irregular menstrual periods, excessive hair growth, and difficulty getting pregnant. The condition was first officially described in 1935 by two doctors, Stein and Leventhal, who identified a link between multiple ovarian cysts and infertility. Because of this, PCOS was originally called Stein-Leventhal syndrome. The term polycystic ovary syndrome was introduced in the 1960s and 70s as researchers gained a better understanding of the condition. Polycystic ovaries describes the way that the ovaries appear on an ultrasound. There are multiple follicles arranged like a string of pearls. These are not the same as ovarian cysts. As more research has emerged, it has become clear that PCOS also affects hormones, metabolism, and overall health, not just the ovaries. People with PCOS have many different symptoms, including irregular or missing periods, high levels of certain hormones, which can lead to acne, excess hair growth or hair thinning, weight gain or trouble losing weight, difficulty getting pregnant, poor sleep, or they might feel down, anxious, or stressed. Many people with PCOS only see a doctor for certain symptoms like weight struggles, extra hair growth, or trouble getting pregnant, and when these start to affect their daily life. To diagnose PCOS, doctors look at symptoms, run blood tests, and sometimes do an ultrasound to check the ovaries. PCOS is a diagnosis of exclusion, meaning doctors must first rule out other conditions that present with similar symptoms, like pregnancy or thyroid issues. That's why seeing a doctor is important if someone suspects that they have it. To diagnose PCOS, doctors look at three main factors. First, a history of irregular or absent periods. Second, high levels of hormones like androgens, which are seen on blood tests or through symptoms like acne, excess hair growth, or hair thinning, and signs of PCOS in the ovaries. For someone to have PCOS, they don't have to have all of those features. They just need to have 2 of 3. So 2 of 3 of irregular or absent menstrual periods, high levels of androgens or testosterone, and a history of polycystic ovaries on ultrasound. What about in adolescence? During adolescence, it is normal to have periods that are irregular, that we don't know when they're coming for the first few years. So can we make this diagnosis of PCOS in adolescence? As the appearance of ovaries change over time, we cannot use an ultrasound until 8 years after the first menstrual period. So a diagnosis of PCOS in adolescence is usually made with a combination of symptoms of irregular menstrual periods after a few years after the first menstrual period and a history of high male hormone levels. What about in menopause, when people are no longer having menstrual periods? Can you make the diagnosis at that point? Yes, we can, based on historical symptoms going back for a history of irregular menstrual periods and high male hormone levels. PCOS is often undiagnosed, with about only half of people with the condition having an official diagnosis. A global survey found that getting a PCOS diagnosis usually takes a year or more and involves seeing 3 or more doctors. The longer it takes to get diagnosed, the more it can negatively affect one's health, and delays in diagnosis mean missed chances for early treatment and better quality of life. Studies in Canada show that many people with PCOS experience doctors dismissing their symptoms and frustrating and negative experiences during diagnosis. Many people with PCOS feel that their symptoms are not taken seriously, and then they often know more about their health condition than the healthcare professionals that they're seeing. This lack of awareness and understanding can damage the doctor-patient relationship, and studies show that people with PCOS tend to trust their doctors less compared to those without the condition. PCOS is a lifelong condition that can lead to various health challenges, including fertility issues, mental health struggles like anxiety or depression, increased endometrial cancer risk, metabolic problems such as diabetes and heart disease. One of the first questions I usually get from patients coming in to see me in clinic is about fertility. They say, "I've been told that I can never get pregnant. Talk to me about fertility." So women of reproductive age report infertility as a major concern, which is defined as an inability to get pregnant for 12 months. PCOS is one of the most common causes of infertility. Compared with women without PCOS, women with PCOS have a 15 times higher odds of infertility. They have fewer children and have a longer time to conception. They're also more likely to seek treatment for fertility. But while women with PCOS may take longer to get pregnant and experience fewer pregnancies, a study of women who were 35 years or older found that 87% of those with PCOS were able to get pregnant, compared with 92% of people without PCOS, so fairly similar. And of those with PCOS, 75% were able to conceive spontaneously on at least one occasion. Once pregnant, one of the questions that we get is, do I need to worry about anything in pregnancy? Are there pregnancy complications for people living with PCOS? So pregnancy complications are health problems that can happen during pregnancy and affect the parent, baby, or both. We know that for women with PCOS, there is a higher rate of miscarriage. There's a higher risk of high blood sugar in pregnancy or gestational diabetes, and of new high blood pressure diagnosed during pregnancy. We also see that babies can be born earlier or preterm. But with the right care, many people with PCOS have healthy pregnancies, and so it's important to diagnose PCOS before pregnancy and manage symptoms early to lower these risks. What about in terms of psychological well-being? People with PCOS report higher rates of mental health issues, including reduced health-related quality of life, depression, anxiety, eating disorders. We also see higher rates of negative body image. Regular screening for psychological well-being is important, and intervention is critical in this population. What about cancer risk? I mentioned that the risk of endometrial cancer is higher for people with PCOS. We see that there is an increased risk for individuals who are not experiencing regular menstrual periods. If the lining of the uterus is not shedding regularly for people with PCOS, it increases the risk of abnormal cells developing, which can become cancer over time. Therefore, if people are not having regular periods with PCOS, it's important to check in with their doctor for possible intervention. People with PCOS have a higher risk of developing health problems like obesity or weight gain that's hard to manage, obstructive sleep apnea, high blood pressure, high cholesterol, diabetes, especially type 2 diabetes, heart disease, heart attacks, and stroke. PCOS is closely linked to insulin resistance, which means the body has trouble using insulin properly. This can lead to high blood sugar levels and can make the symptoms of PCOS worse. For example, people with PCOS are 4 times more likely to get diabetes than people without PCOS, and this often occurs at an earlier age. This is even higher if people have excess weight, and it occurs more frequently with weight gain over time. Because people with PCOS have a higher risk of heart disease, diabetes, and other health problems, regular checkups are important. Experts recommend yearly checkups to monitor weight and blood pressure. It's recommended to get screened for diabetes and high cholesterol at the time of diagnosis. And then ongoing screening is recommended based on an individual's personal risk for cardiovascular disease, which could occur between 1 and 5 years. There is no cure for PCOS, but the main goals of management are first to manage the symptoms, and second, to prevent and identify complications. When we're managing the symptoms, we're thinking about things that are bothersome to a patient, like irregular menstrual periods, excess hair growth, and acne. For preventing and identifying complications, we're thinking about long-term things like diabetes, heart disease, and fertility issues. To achieve these goals, we have 3 main approaches that we can use. I think of it as a toolbox when we're talking about it in clinic. We have lifestyle management, we have medications, and we have weight loss surgery or metabolic surgery. In terms of lifestyle, this includes healthy eating, regular exercise, and weight management, which are essential for controlling symptoms and reducing the risk of complications. When we think about medications, there are several medications that are used to treat PCOS. However, many of these are not specifically approved for PCOS, and therefore we use them off-label. For example, progesterone tablets can be used to regulate menstrual periods. Combined oral contraceptive pills or birth control pills can be used to help with irregular periods, as well as symptoms like acne and excess hair growth. Hormonal IUDs can help with regulating periods and preventing pregnancy. Spironolactone can help with excess hair growth and acne. Metformin is usually used for insulin resistance or if somebody develops diabetes. Semaglutide, or people may be more familiar with Ozempic or Wegovy, can be used for weight loss and for helping with insulin resistance. And letrozole to help with ovulation in people trying to get pregnant. There are a lot of different medications, but none of these specifically addresses PCOS as a whole. They more so treat specific symptoms, and so personal discussions between a provider and a patient are important to find ones that work best. In terms of metabolic surgery, we know that for individuals with excess weight, there are benefits to metabolic or weight loss surgery in terms of metabolic and reproductive health. Lifestyle changes are recommended for everyone with PCOS to improve overall health, metabolic function, and quality of life. A main focus for managing PCOS includes nutrition. While there are many studies on specific nutrition plans for PCOS, there isn't one nutrition plan that's universally recommended. Instead, the guidelines suggest a well-balanced diet, with the goal being something that is sustainable, something that we would be able to do in the long term and that works with our goals and our lives. Many people with PCOS find it helpful to see a dietitian to make sure they are eating a balanced diet and getting the nutrients that they need. A lot of people ask about supplements when they come to see us in clinic. Inositol is the one supplement that has been studied in PCOS and is recommended in the PCOS guidelines to help with metabolic health and menstrual regularity. There are many other supplements being promoted for PCOS, but we don't yet have enough evidence to support their use. Exercise can help improve the signs and symptoms of PCOS, but there is no one type of exercise that has been proven to work better than others. The general recommendation for people with PCOS is consistent with what's recommended for the general population, which are 150 minutes of aerobic exercise per week, doing things like cross-country skiing, walking, cycling, or swimming, and strength training on 2 non-consecutive days. The level of activity can help to improve overall health, manage weight, and reduce the risk of other health issues like heart disease and diabetes. During my training to become an endocrinologist, I saw many women with PCOS in clinic who had very similar questions. Great, you told me to exercise. I already exercise. What is it that I should be doing? Is there a specific type of exercise that I should be doing for my PCOS? To explore this, we conducted a study where women with PCOS who were not regular exercising were randomly assigned to either exercise training 3 times a week for 6 months or continuing their usual activity level. And then the women in the exercise group were further divided into 2 other groups. Continuous aerobic exercise, where they exercised at the same intensity level for the whole session, and high-intensity interval training, or HIIT, where they did high intensity alternating with low intensity. The study showed that exercise helped to improve cardiovascular risk factors like cholesterol levels and insulin resistance. It helped with fitness levels, and there were some reproductive health outcomes that improved, including some participants had improvements in the regularity of their menstrual periods. This suggests, along with other studies, that exercise can be an important tool for managing PCOS and improving overall health. As we continue to explore exercise as a way to manage PCOS symptoms and reduce the risk of diabetes and heart disease, there are still many questions to answer. What type of exercise is best for PCOS? How many days per week should someone with PCOS be exercising? At what intensity and for how long should they exercise? Is there a best time of day to exercise? Do these recommendations change based on factors like age, plans to get pregnant, or other health conditions like depression or diabetes? And will certain exercise types or lifestyle changes help to prevent fertility issues or heart disease? Once we find answers to these questions, we also need to figure out how to help people apply these recommendations in real life. There are many barriers to exercise, including lack of time, competing priorities, cost or lack of access, cultural factors or personal preferences, and motivation to stay active. These barriers have been identified, and they often make it hard for people to maintain exercise throughout their lives. We need to find more sustainable strategies that people can use in real life when we're thinking about a treatment plan. Despite the wide-ranging effects of PCOS on a person's life, we don't have effective, targeted interventions that can consistently manage symptoms and reduce the long-term health risks associated with this condition. Although many social media accounts promote diets or weight loss programs to help with the management of PCOS, we don't yet know if there is a one-size-fits-all diet or exercise plan that works for managing PCOS symptoms and reducing the risks of long-term health conditions. A question I get asked often in clinic: what medication is right for my PCOS? What nutrition plan should I use? There is growing interest in precision medicine in PCOS, which means developing more personalized treatments that can better match each person's unique needs. This idea has been strongly supported by patient advocacy groups, including those held at international meetings, including those held by the Androgen Access PCOS Society. As we continue to learn more about PCOS and its causes, we need to focus on tailoring treatments to the individual. Factors like age, hormone levels like testosterone, and body weight could influence how someone responds to different treatments. This could open up new possibilities for personalized management of PCOS in the future. There are a few take-home pearls that I want to highlight about PCOS. PCOS is a common hormone condition that affects people with ovaries, leading to various short and long-term complications. Routine screening for conditions like diabetes and depression is crucial, and while there is no cure, PCOS can be managed through lifestyle changes, medical treatments, and weight loss surgery. Oh, I got stuck. There we go. Okay. There is a lot of misinformation that exists regarding PCOS diagnosis and management on the internet. Our lab, the Embrace Women's Health Research Lab, is working with clinicians and researchers from around the world through the Androgen Access PCOS Society to address misinformation related to PCOS. There is a lot of work to do in this space. For those that are impacted by PCOS or suspect that they may have PCOS, there are some evidence-based resources that are currently available that I have highlighted here on this slide. If you do not have PCOS, these resources can also be useful to support someone with PCOS in your life. The middle one there, the Ask PCOS app, was developed out of Monash University in Australia, which is the leading research and clinical care center for PCOS in the world. And on the right, the Alberta Health PCOS pathway lays out helpful ways to navigate the PCOS journey through diagnosis and management. And as I wrap up here, although there are still many questions about how to manage PCOS, our understanding of the condition is improving, and more people are becoming aware of it. We are working hard to find more credible information for this condition. We are currently working with a group of patient partners within Alberta to try and develop tools to help with the self-management of PCOS. By working with patient partners, we want to make sure that these are easy to use, have the content that is most desired by people living with the condition, and that they're helpful at the end of the day for managing their condition. So where do we go from here? Women's health has historically been understudied and underfunded. We need to continue to advocate for women's health research funding so that the research community can continue to make discoveries that can improve the lives of women living with PCOS and other conditions that women are impacted by throughout their lives. We need to improve access to care and prioritize patient-centered care to address the diverse needs of people living with PCOS. Innovative care models for the diagnosis and management of PCOS are desperately needed, such as establishing multidisciplinary clinics involving the wide range of practitioners that are involved in the care for people living with PCOS, like dietitians, exercise specialists, gynecologists, fertility specialists, endocrinologists, dermatologists, and many more people who are involved in their care. And as a final point, we need to talk about the name. The name polycystic ovary syndrome doesn't fully capture the wide-ranging effects of this condition. It instead focuses on the ovaries. And the International PCOS Network is working on renaming the condition to better highlight the vast effects that it has on patients. So with that, I thank you for your time and welcome any questions.